Welcome to the Headless Professor video series. Today we're talking about reliability in psychological measurement. When we say that a given measure of a variable is reliable, we do not mean to imply anything about validity, whether or not it actually measures what it is supposed to be measuring. Reliability only means consistency of measurement. The way that we establish reliability of a measure is we have to use it in more than one way and see if it in fact correlates with itself. An easy way to conceptualize this would be to use the 2x2 contingency table. The rows represent the first measurement or aspect of the measure that we do, and the columns would represent the second aspect of our measure. And if each aspect gets a yes, then we have an agreement. And if each aspect gets a no, we again have an agreement. And if our agreements are greater than our disagreements, then we have a consistency of measurement. We have reliability. Now there's several different types of reliability, and perhaps the major issue of reliability is what we call test-retest reliability. In other words, if we're going to give a test more than once to the same set of subjects, are we going to get similar scores over time? Are the same people who score high on the test the first time we give it going to be the ones who score high on the test the next time we give it? And are the same people who scored low on the test the first time we gave it going to be the same people who scored low on the test the second time we gave it? If so, we have test-retest reliability, stability over time. So here, measure 1 represents how people did on the test, scored high, score low the first time they took it, and measure 2 represents the second time they took it. If the people who scored high the first time scored high the second time, they would be placed in this cell right here. And if the people who scored low the first time also scored low the second time, they would be placed in this cell right here. The people who would be placed here scored high the first time, low the second time. People who would be placed here scored low the first time, high the second time. And if most of our subjects wound up here or here, we have an agreement, a stability, consistency between the first measure and the second measure. The other form of reliability frequently utilized is called inter-rater. Imagine that we have two people rating movies or candidates for an interview, and each rater will say, thumbs up, I like this, or thumbs down, I don't like this. And what we see here is if the two raters agree most of the time, then we have inter-rater reliability. Suppose we are diagnosing some patients. Rater 1 is a clinical psychologist who will say, yes, the patient has the disorder, or no, the patient does not have the disorder. Measure 2 might be a psychiatrist who says, yes, the patient has the disorder, or no, the patient does not have the disorder. If they both agree on a patient, the patient would be classified here. The patient has the disorder. Or if they both agree the patient does not have the disorder, we would place the patient here. As long as the psychiatrist and the psychologist agree with each other, we have inter-rater reliability. We would put the patients here or here if there is some disagreement, where one mental health professional says the patient has the disorder and the other says the patient does not have the disorder. There are other kinds of reliability as well. For example, there is internal reliability, which means does the test have different parts, and do the different parts of the test show a consistency between the different items. Then we have sometimes a situation of alternate form reliability, where a given test may have two different versions, an oral version and a written version, or a telephone version and a computer online version. Once again, we would give each patient both versions of the same test and see if the two versions agreed with each other. So, that's what we mean when we talk about reliability. Consistency between different approaches to using the same measurement.